Okay, so the way that our body maintains homeostasis, which is equilibrium with regards to blood glucose, um, has to do with the production of insulin, which occurs in the beta cells of the islet of Langerhans section of the pancreas. Two diseases that interfere with that production are type 1 and type 2 diabetes mellitus. Type 1 diabetes mellitus is an autoimmune condition where your immune system basically attacks uh, the insulin producing cells to where the pancreas can't make insulin anymore. It usually occurs early in life, early childhood or early adolescence, um, and it usually appears suddenly. Some typical symptoms that a person will have is polydipsia, so frequent thirst, polyuria, excessive urination, polyphagia, excessive hunger. Um, the excessive hunger can also cause weight loss as well. Diplopia, so blurred or double vision, that type of thing. It's tested by use of fasting blood glucose tests and monitoring the A1C, which is a specific protein in the blood that has to do with blood glucose. And the treatment for it is typically exogenous insulin, and then also making sure you're maintaining healthy lifestyle changes such as uh, adequate exercise, a proper diet, limiting your sugar intake, that kind of thing, just to keep in your carbohydrate intake as well, just to keep your body healthy. Type 2 diabetes used to be called adult onset diabetes because it's a slow building, progressive disease. In the past, it was called that because it was typically diagnosed in adulthood, but now it's being diagnosed earlier, even in childhood and adolescence as well. Type 2 diabetes will have similar symptoms with regards to polyphagia, polydipsia, polyuria. Um, the the way that type 2 diabetes works is that the beta cells aren't they will produce insulin but they won't produce enough, or it will interfere with the receptor cells' ability to take in insulin to lower the blood sugar levels. Typically, type 2 diabetes is usually treated with dietary changes, exercise, limiting sugar and carbohydrate intake. But if that doesn't work, then typically it can be used with medication or even some insulin therapy as well. Um, if untreated, there's a lot of terrible things that can happen. It can damage your circulatory and your nervous system, um, basically resulting in paresthesia or numbness in the distal extremities, to where small scratches or small cuts can turn into full ulcerative infections that eventually can require amputation. It can cause neuropathy, so the tingling and burning sensation, typically in the distal extremities as well. Um, the main difference between those two is how they affect the insulin producers as well as the insulin receptors of the body. And typically, type 1 diabetes requires exogenous insulin, whereas type 2 diabetes can be monitored mainly through dietary changes and exercise. Not saying that type 1 can't benefit from that, but that's the main treatment for type 2. Type 2 is preventable, type 1 is not as well. So those are the two main types of diabetes mellitus that affects insulin production and alters glucose homeostasis.